Hello, everyone, and welcome back to my YouTube channel. Today, we are delving into the intricate world of thyroid health, and specifically, we will be unraveling the significance of the thyroid function test, that is TFT. So, if you have ever wondered about the thyroid's role in your body and how this test can provide valuable insights, so you are in the right place. So, watch this video till end for more knowledge and stay connected with us for more informative videos like this. Let's embark on this journey of understanding thyroid function tests and their and their importance in maintaining optimal health. Let's talk about thyroid function test. First of all, I would like to talk about the anatomy of the thyroid gland so that you can understand it very well. So, the thyroid gland is an endocrine structure which is located in the neck. It plays a key role in regulating the metabolic rate of the body, and it is responsible for helping regulate many bodily processes such as metabolism, energy generation, and mood. The thyroid produces two major hormones, that is T3 and T4, triiodothyronine, and T4 is thyroxine. So, if your thyroid gland does not produce enough of these hormones, you may experience symptoms such as weight gain, lack of energy, and depression, and this is called hypothyroidism. And if your thyroid gland produces too much hormones, then you may experience weight loss, high levels of anxiety, tremors, a sense of being on a high, and this is called hyperthyroidism. Now, next we'll talk about the anatomical location of the thyroid gland. So the thyroid gland is located in the anterior neck and spans the C5 to T1 vertebrae. It consists of two lobes, left and right, which are connected via central isthmus anteriorly. This produces a butterfly shape appearance. The lobes of thyroid gland are wrapped around the cricoid cartilage and superior rings of the trachea. The gland is located within the visceral compartment of the neck, along with the trachea, esophagus, and pharynx, and this compartment is bound by pretracheal fascia. So, this was all about the anatomy of the thyroid gland. I hope this is clear to you. Now, let's understand thyroid function test. So, blood tests to measure these hormones are readily available and widely used, but not all are useful in all situations. So, tests to evaluate thyroid functions include first TSH test. The best way to initially test thyroid function is to measure the TSH level in a blood sample. So, changes in the TSH can serve as an early warning system, and often occurring before the actual level of thyroid hormones in the body becomes too high or too low. A high TSH level indicates that the thyroid gland is not making enough of the thyroid hormone, and which is called primary hypothyroidism. The opposite situation in which the TSH level is low usually indicate that the thyroid is producing too much thyroid hormone, and it is called hyperthyroidism. Occasionally, a low TSH may result from abnormality in the pituitary gland, which prevent it from making enough TSH to stimulate the thyroid, that is, secondary hypothyroidism. In most healthy individuals, a normal TSH value means that the thyroid is functioning properly. Second test is T4 test. So, T4 is the main form of thyroid hormone circulating in the blood. A total T4 measures the bound and free hormones and can change when binding protein differs. A free T4 measure which is not wound and able to enter and affect the body tissues. So, test measuring free T4, either a free T4 or free T4 index, that is FT1. So, more accurately reflect how the thyroid gland is functioning when checked with the TSH. The findings of an elevated TSH and low FT4 or FT1 indicates primary hypothyroidism due to disease in the thyroid gland. And a low TSH and low FT4 or FT1 indicates hypothyroidism due to problems involving the pituitary gland. A low TSH with an elevated FT4 and FT1 is found in individuals who have hyperthyroidism. Next test is T3 test. So, T3 tests are often useful to diagnosing hyperthyroidism or to determine the severity of the hyperthyroidism. Patient who are Patient who are hyperthyroid will have an elevated T3 level, and some individuals with a low with the low TSH and only the T3 is elevated and the FT4 or the FT1 is normal. So T3 testing rarely is helpful in the hyperthyroid patient since it is the last test to become abnormal. So patient can severely hyperthyroid with a high TSH and low FT4 and FT1 but have a normal T3. Next is free T3. So measurement of free T3 is possible but is often not reliable and therefore not typically helpful. Reverse T3 next test. So reverse T3 is a biologically inactive protein that is structurally very similar to the T3, but the iodine atoms are placed in different locations which make it inactive. So some reverse T3 is produced normally in the body, but it then rapidly degraded. And in healthy, non-hospitalized people, measurements of the reverse T3 does not help determine whether hypothyroidism exists or not, and it is not clinically useful. Next, we have thyroid antibodies. Let's talk about it. So, if the initially thyroid test result shows signs of thyroid problem and if there is a suspicion of autoimmune thyroid disease, so one or more thyroid antibody tests may be ordered. Antibody tests are used to confirm the diagnosis of autoimmune thyroid disease. I have already made a video on this. You can watch this. Some peoples will test positive for more than one type of thyroid antibody. If people with subclinical thyroid disease, the presence of antibodies can indicate that a person may go on to develop full brown thyroid disease in the future. The treatment is not yet required. And positive antibodies can also be present in the people with the thyroid disease. On the screen, you can see we have given a chart of antibodies and what do they indicate. You can see them clearly and try to understand them. So, this was all about the thyroid function test. I hope this is clear to you people. So, that's all. In conclusion, I want to say that thyroid function test serves as a valuable tools in assessing the health of this small but mighty gland, that is thyroid gland. So, regular testing coupled with a healthy lifestyle and communication with healthcare providers can ensure that your thyroid orchestra plays harmoniously and contributing to your overall health well-being. So if you find this video informative, valuable and especially helpful, please give this video a thumbs up and subscribe to our YouTube channel and hit the notification bell for more insights into the world of homeopathy and natural healing. So thank you so much. So thank you so much for joining me on this exploration of the thyroid function test. So take care. See you guys in the next video. Till then, stay safe and stay healthy. And if you are suffering from any of the health issues, you can contact us for online appointments. On the screen, you can see how to contact us. So that's it for now. And thanks for watching this video.